Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world, and I give you expert insights on infectious diseases and public health. This is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. And I do this with my friend and colleague, Dr. Jon Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases all around the world. Thanks, Jon, for joining me today.
Jay, thanks as always for having me. I feel like it's been a busy week. There's
It
a
has
lot that's
been,
happened.
there's a lot going on. I mean, I think this is the kind of exhaustion of the information ecosystem we live in, right? Just information doesn't stop flowing.
Doesn't stop flowing, and in some cases it needs to continue to flow because if we're not talking about some of these issues like we're going to get to today, a very important one about the vaccine committee that met last week and some pretty important outcomes along those lines, if we're not talking about these things, then we're really truly lost.
Yes, exactly. And I think one of the challenges that you and I face and a lot of our colleagues face is that, the things that we're talking about don't necessarily get as much attention, right? Because we're trying to push things that are broadly understood and known and accepted. And what often gets the most attention are these kind of wilder counter narratives, unfortunately, most of which are completely false. But they
Yeah.
get attention because they're different.
I know. What I like about the conversations we have, though, is that there's often a connecting theme. We talk about a whole spectrum of outbreak news, right? Whether it's a purely human disease that's going on, whether it's zoonotic and there's animals and humans involved, and sometimes even just veterinary diseases. But across the whole spectrum of conversation, it's, what's causing these things to happen? What do we need to know about them in order to prevent them? And where do we go from here? And that's what I think is useful because we're going to continue to see infections and outbreaks and in many cases in the United States for for reasons about immunization we're going to see even more infectious disease outbreaks.
Yeah, without question. I mean, the overarching strategy when you look back at 2025 for public health in the United States at the national level, the federal government has basically been the sort of revenge of the COVID contrarians.
Mm,
And all of the people that got elevated into positions of power,
yes.
these were not people who have any experience running large public health agencies or public health programs. They were basically tagged for these positions because they took very contrarian positions during COVID that fit a very partisan political narrative. So much of what they've done hasn't really been about trying to actually, I would say, improve the health of the United States. It's actually been about taking revenge on infectious disease and public health experts.
I
And
know.
we'll get to that in a moment, as we go through this discussion. And so that, unfortunately, is going to have its own set of consequences.
Yeah.
The consequences that people like myself for decisions that we had to or things we had to advise and recommend on and decisions we had to make during COVID, these were all just a balance between bad and worse, right? We were just trying to figure out how do we get through this crisis with as few people dying and disabled as possible. But the
Yeah, and
decisions being right now are political. They're not preventing any disease.
that's right. And so when we start making, policy-based decisions that ignore evidence, we really run the risk of, going so far off track that when we're hit with another crisis, we're just totally unprepared and we don't know who to believe in terms of information or where to look for a trusted source. Which again is why I really appreciate, the conversations we're having, because I think you and I both believe very strongly we want to be a trusted source of information to report factual information about a topic, because we're going to need these reference points, these touchstones down the road when we're dealing with crises again.
Yeah, and the really crazy thing is that one of the things I find incredibly crazy is that so many a huge component of this COVID contrarian narrative and this "Make America Healthy Again" narrative is about minimizing the importance of infectious diseases, arguing that they are overblown, in some extreme cases saying they don't even exist. And all that's going to happen from what they're doing is going to be all this progress that we've made that's gotten people to believe that infectious diseases aren't a problem is just going to come back and show that it's the problem.
No, and
Um,
it there's so many layers to this, but in addition to that, It's also a movement of casting doubt on what we do know based on scientific evidence. It's not saying that there isn't evidence to support, this outcome or this vaccine is safe. It's calling into question the validity of that evidence, calling into question how much we should believe, in some cases, decades of studies and reports. And once you cast that doubt, anybody who's predisposed for whatever reason to be skeptical about medical practice is going to be really confused about who to believe and where to turn.
That's exactly right. But as we are going to talk about in our first story here, even rare infectious diseases can cause serious complications and can come back to hurt us in ways that we don't really realize. So we're going to get in, as I said, one of our topics is going to be talking about some of the broader scale problems. So let's start with a topic that
Okay.
is near and dear to your heart. And it's just
Yes.
another, and the reason I chose it is because it's yet another example of the ways in which, much as we would like to think that infectious diseases are behind us, they're actually sitting right in front of us all the time. So the first story is about rabies. And you and I have talked before about rabies and how it's primarily or almost exclusively transmitted by animals. But here's an example of where rabies is transmitted by a human to another human through a medical procedure. So in January, doctors in Ohio notified the Ohio Department of Health and CDC about a suspected case of rabies in a kidney transplant who died 51 days after receiving that transplant. So, how did somebody who just got a kidney transplant get rabies? Well, it turns out that the person who died and donated their kidney had actually been bitten by a skunk approximately 6 weeks before their death. So, again, this is the donor person, the person who gave their kidney up. And it turns out that they, in fact, were incubating rabies. Now, thankfully, no other organs were donated from this deceased person. 3 persons did receive cornea tissue, but the doctors actually preventatively took out the corneas and gave the people who received them post-exposure prophylaxis. But CDC went and did some specialized testing on archived samples of the donor's kidney, and in fact proved that the donor who gave this kidney and then died, presumably not of rabies, but died of something else, actually transmitted rabies, unfortunately, to somebody who got a kidney transplant. So,
Yeah,
John,
Jay.
what do you think about this?
So interesting. Unfortunate, but not the first time we've seen rabies transmission happen through organ or tissue transplantation. There are historical cases of corneal transplants from people who have died from rabies that have transmitted rabies to the recipient. And so this is not unprecedented. Want to correct one thing that you said, just because it's important detail for how we understand rabies transmission from animals, and that is that the person who got infected was scratched by a skunk, not even bitten.
Ah,
So a scratch might seem pretty innocuous. We get scratched by our pet cat. We get scratched by, handling pets sometimes, not a big deal. But rabies virus is a virus that carried by mammals, and in the United States, it's carried predominantly by bats and by carnivores, so terrestrial carnivores like skunks, fox, raccoons. These are all animals that can carry and transmit rabies, and it's excreted in the saliva. So when we classically think of a rabid animal that's in a furious state of clinical disease and they're bitey, so that bite will, break the skin, and saliva, which has got the rabies virus in it, gets into our tissue. The way scratches work is anything that breaks the skin is actually a pretty effective barrier against rabies virus. But when you get scratched and it breaks the skin, animal claws can have saliva on them because they groom, they eat, they touch their paws a lot. So it's actually just a vehicle for also getting saliva into a wound. And that's the risk of being scratched.
oh, that's so interesting. Yeah, that's right. I never really thought about the fact that, I always assumed that it had to be some type of direct salivary transmission, but it makes sense that animals, just like toddlers or other people or even I guess adults, they wipe their hands across their mouth in some way and can actually be transmitting infections the same exact way.
That's right. And so sometimes it's a lot easier to dismiss a scratch from an animal, especially if it didn't hurt that much and it's, barely an abrasion. It's easy to dismiss that without even thinking about a consequence. And in fact, one of um, the most kind of insidious ways that rabies might be transmitted is there's a very common occurrence is people will be, staying in a hotel, a house, a cabin, whatever, where there are bats that get inside, and they wake up in the morning and there's a bat flying around their room. And bats are so small that you may not even wake up if that bat lands on you and scratches you or even bites you. It can be very slight, very light. And so the medical protocol, if even if you wake up with a bat in your room and you don't think you've been bitten or scratched, is you then go to the hospital and receive rabies post-exposure prophylaxis, which is a series of injections, because you just don't know. And the thing about rabies, Jay, as you know very well, is this is a virus that's 100% fatal once people get exposed. So it's it's one to be taken very seriously, even though human cases of rabies are extremely rare in the United States. We only have about 1 to 3 cases a year, but it's something you take seriously if there's even the possibility you've been exposed.
Yeah, and I think one of the things that's so insidious about rabies, and on top of the fact that it is 100% fatal, which is pretty rare as far as infectious diseases go. I mean,
Mhm.
HIV is probably one of the only other examples, and that is fatal over a longer period. But one of the things that's very insidious about rabies is the fact that it hangs out, right? It hangs out in your
Right.
nervous system for quite a long time, for many weeks. And so I guess, and this is another example of which where the person had been scratched, they were probably destined to develop rabies and die from it. But they were obviously not symptomatic at the time that they were deceased, and so nobody actually knew that they were incubating this virus.
And we don't have a standard screening protocol for organs from donors for rabies virus. I mean, we might screen for HIV from the donor, but there are some viruses that just are rare enough. They're not really standard protocol. They're not on the radar. And so this is a case where the kidney, there was rabies virus in the kidney tissue and the nervous tissue associated with that. And the way that rabies gets to us is that, starting with, in the classic sense, a bite or a scratch, it gets into the muscle tissue and then it enters the peripheral nerves, the nerve endings that are in our muscle around the bite wound. And rabies virus travels along the nerves. It actually uses the nervous system to move towards the central nervous system. And it can move slowly, Jay. And that's why sometimes clinical signs don't show up for 10 to 50 days after a person is exposed. It can take a while for that virus to make its way to the spinal cord and then eventually the brain. When it gets to the brain and starts replicating, that's typically where we start to experience the symptoms of encephalitis. So the disorientation, the fever, the nausea that progresses into, a state of muscle paralysis and even coma.
Yeah, and there is no diagnostic test that I can think of that would be readily available to test let's say a person dies in a car accident and then you're going to donate their kidneys that could be used to screen for this very rare but obviously devastating risk.
Well, it's
Um,
interesting because they retrospectively diagnosed it. They must have taken a tissue sample from the kidney prior to transplantation.
Yep.
It's really the only way if someone had the foresight to, screen it, and why would they? But in retrospect, they screen it. It had rabies virus RNA in it, and they detected it that way.
Yeah, exactly. So anyway, so this is just another example of the unusual ways in which humans and animals can interact and unfortunately cause some devastating complications from infectious diseases. And so, yeah, I mean, CDC's statement on this was essentially that recommending that organ transplant centers think about ways to coordinate with public health authorities. But I honestly can't think of an easy way that would ever get done. Again, because remember, the people donating these organs are doing it because they died almost inevitably. I mean, there are obviously situations when people are living kidney donors. That is very common also. But in many situations, they've died. And so it's unlikely that a family member or somebody else would remember that this person was scratched by a skunk or maybe even by a bat. Because you point out, sometimes these are things that people just kind of don't even really think about because they seem fairly minor incidents.
Right. Right. And again, when it's such a rare thing, I mean, we're talking about this. This is a rare situation. So, there's only so many resources to screen, and we tend to screen for the major viral infections, the major things that could impact an organ recipient's life. And, even though rabies has, terrible consequences, it's rare enough that it doesn't make the cut typically.
Exactly. Okay, so let's move on to our second topic of the week. And this is one that we've touched on before, and it isn't specifically a human health threat, but it does have very important human implications. And this is the screwworm. And so, as we've talked about briefly before, this is a infection that is widespread among domestic animals and has become widespread among domestic animals and wildlife in Central America and southern Mexico. And it presents a very dangerous risk to the beef supply in the United States. And now, of course, there's already a risk that we're facing in the United States of avian influenza, bird flu, impacting dairy cattle, right? So we use cows often to help produce, cheese and milk and dairy products. But we also use cattle, obviously, to eat beef and to eat their hamburgers and steak, etc. So this is a huge industry, as we all know, particularly in
Mhm.
states like Texas. And the fact that this infection is spreading more rapidly among domesticated animals and wildlife in Latin America is posing an emergency threat. And now the USDA has even launched a centralized website to track all of the work that's being done on this, including the intelligence and epidemic information about where it's spreading. So, John, can you give us a little update on this? Because it is something that I think people should be thinking about, because it could certainly impact our beef supply, in addition, obviously, to the health of animals being raised in the Southwest of the United States.
Yeah, Jay, this is an example of actually where I think our government is doing an incredible job at marshaling all its resources against a very clear and present danger, an imminent threat. And screwworm, we've talked about it before on this show, but screwworm is it's a fly that lands on cattle and lays eggs, and its larvae are incredibly damaging to the flesh and the tissue of livestock, particularly cattle. So once the flies are around and they're laying eggs, the larvae are very hard to get rid of, and so it can be devastating. It spreads among cattle herds, and it can be fatal for the cattle, and it also has an incredible economic cost to the beef industry. And so, because Texas in particular is right on the Mexico border, and the front, if you will, of the flies that spread this disease is moving northward through Mexico. And just historically, this is a disease we have eradicated in the United States. So it used to be present. It was eradicated through an intensive strategy that primarily involved releasing sterile flies into the environment that would prevent the flies from effectively breeding and making more larvae. And that was an effective strategy. So that has been resurrected as part of the US Department of Agriculture's strategy. Major, massive investments, not only in the United States, but in partnering with Mexico to breed sterile flies. And it takes millions of them, but release them into the environment to try to hold back the front of this advancing parasite. And so, as you mentioned, Jay, right now not only the concern, but the expectation is it's likely screwworm will get into the southern United States. And so that's why there's such a heavy investment by the US government, not just in the USDA, but Jay, this is a great One Health response. The CDC is involved, the US Department of Interior is involved. There's the Department of Defense, all these different agencies, State Department, in really working with our international partners in Mexico and Central America to combat this disease, which is going to have devastating consequences should it get into US beef producers.
Yeah, and it's good to hear that, we talk so often about how much damage the current administration is doing to the public health infrastructure. So I'm very heartened and, pleased to hear that there is an aggressive multi-agency response to this, because these types of problems, again, if they are not addressed ahead of time, the damage they cause can be absolutely devastating, right? It takes such a massive investment, as you point out, to develop like a whole sterile fly operation and to coordinate all the information, and also the multinational cooperation. And again, this is something that I've been worried about. And it's good to hear that this hopefully is not becoming a problem. Obviously there's so much being talked about, like protecting the border from human migration. But in fact, we also need to keep in mind that animals migrate as well too, for
Yes,
economic reasons, right? There are cattle bred in Mexico all the time that are brought across the border
that's right.
and sold into the United States. And so it's important that, regardless of what the immigration politics are, that there be a lot of coordination and good relationships when it comes to disease control in agriculture.
Yeah, this is something that definitely requires coordination, particularly around the border with Mexico. And there are concerted efforts to make sure cattle aren't moved illegally across the border that might be carrying not only screwworm, but there's another disease called cattle fever that's a tick-borne disease that's of concern. And another thing worth mentioning is that as part of the strategy to combat screwworm, the FDA has rushed to emergency approval a topical medication that can be applied to cattle to prevent screwworm, to prevent the flies from laying eggs there and having larvae. And so that's another tool that's been kind of fast tracked to the fore that could be used to prevent spread.
Oh, wow, that's great. So that would be applied to herds of cattle, I guess.
That's right, as a
Okay,
preventative.
the preventive. Okay, good. Well, speaking of prevention, you and I know that far and away the greatest advance in public health that came from biomedicine, not from clean water, clean air, clean food. Those are all huge, important advances that occurred in the 20th century. But it was also the development of vaccines. And unfortunately, one of the common themes that you and I have been touching on over all our shows has been the incredible opposition to vaccines from the current administration. And unfortunately, we saw one of the most devastating consequences of that this past week. So, to bring viewers, up to speed, CDC has something called the Advisory Committee on Immunization Practices, and this is meant to be a committee of recognized experts on public health, clinical medicine, and infectious diseases, who independently review all of the data and all of the evidence about vaccines and their effectiveness in populations, their acceptability, their safety, and use this incredibly rigorous process historically to recommend what vaccines should be incorporated into what's called CDC's childhood and adult immunization schedule. So these are recommendations that are taken as really official for clinical providers, for schools, and for states to mandate what vaccines should be included in sort of for school entry and what should not. So unfortunately, the current administration has basically fired everybody who was original on the ACIP, replaced them with people who are not experts. And last week, they took one of their first salvos at the U.S. vaccine policy, basically taking away the current recommendation, which is that every baby who's born in the United States should receive, at the time of birth, the hepatitis B vaccine. And so, Jon, let's talk for a little bit first to educate our viewers about what hepatitis B is. And then we can talk a little bit about why this vaccine is so important and dispute some of the kind of messages that have gotten out there from the anti-vaccine world. So, Jon, why don't you start a little bit by giving us some background about hepatitis B?
Well, hepatitis B is a virus. And it's a viral infection that traditionally among adults is sexually transmitted, but it can be transmitted, what we say vertically. It can be transmitted from mother to child through bloodborne routes in utero. And it's something that it causes a chronic infection. So rather than causing a short term, severe sickness, it lasts in the body for a long time, and it causes a chronic low-grade infection that can lead to either severe liver disease and in some cases even cancer. And so there is a lot of reason to prevent this virus from ever taking hold in newborn children, because it's incredibly difficult to deal with once it does establish a chronic infection. And most infections in children, Jay, correct me if I'm wrong, but most will become chronic infections if there isn't a preventative vaccine applied, right?
Yeah, yeah. And let me just add a little bit to what you just said. I mean, one of the reasons, so in addition to the sexual route of transmission and the route of transmission from mother to baby, it can also be transmitted through contact. People
That's right.
have always been historically very worried about HIV infection. Hepatitis B is far more infectious than HIV. So one of the first outbreak investigations I did when I went to CDC first as a medical student to do a medical student rotation, I did an outbreak investigation. I assisted as a student, so I was just assisting on this, an investigation at a dialysis center. So at
Hmm.
dialysis centers, this is where, people with kidney disease go in and they basically get attached to a machine and have their blood filtered through something because their kidneys aren't working. Well, hepatitis B is incredibly common in this population because it's very, people are getting all this tubing and getting injections. And this virus can basically live on the top of IV tubing, on the top of vials that are used for medications that are given to patients as well. So this is an incredibly hardy virus. And so the reason we worry about it is, one, as you rightly pointed out, it is highly infectious. And number two, as you pointed out, it causes tremendous complications like severe liver damage and cirrhosis and liver cancer. And finally, most importantly, there is no cure. So I treat patients, many of whom have HIV infection, and some of them have hepatitis B. There is no cure. All we can do is give them medications, many of which are similar to those that are used for HIV to help try to keep the virus at bay. So
Hmm.
this is the perfect virus for why we need a vaccine, right? It's highly contagious, it causes devastating complications, and there are no drugs to treat it.
Yeah.
So, what has been developed in the United States is this policy that we vaccinate all babies at birth because we don't know when people can get infected. Even though sexual transmission is the most common mode, it's not the only one. and the vaccine is incredibly safe. But there has been a sort of a common anti-vaccine trope is that babies shouldn't get vaccinated because it will lead to autism or some other complication. Now, none of this has ever been proven, but there is this sort of emotional reaction, this idea that how can you dare inject a baby with this vaccine? And so as a result, this has been sort of number one on the list of things for the anti-vaccine movement to remove. And they successfully basically made the case that they will no longer require a birth dose of vaccine or recommend it as standard, and that it should only be done in certain risky situations. Now, unfortunately, as you know from clinical practice, and I do from my clinical practice, it's very hard sometimes to say that, well, we'll just leave this up to doctors, right? There have to be some strong recommendations and policies sometimes to make sure things become universal.
Yeah, and it's important to probably mention that the US for a long time has been vaccinating newborns against hepatitis B. This is not a new protocol, it's not a new thing, but it's led to a dramatic reduction in infections, hasn't it, Jay? I mean, this has been a proven practice that's been very effective at controlling hepatitis B.
Yeah, let's go through a couple of the numbers here. Basically, the reason, and so people will say, well, why can't I just choose whether, I should know whether I have a risk of hepatitis B? The simple fact is while people like you and me have a lot of privilege, the vast majority of people in the United States don't have that level of privilege. And a fairly large number of people don't get regular prenatal care. Mothers don't
Right.
get tested properly. They don't. And so as a result, before this hepatitis B universal recommendation was in place, over 30,000 children under 10 in the United States got the vaccine each year. And it was about half of them got it during birth. And so there were already a fair number of people, but it was only a sort of a fraction of all of the births that were actually occurring in the United States. And the dilemma was that about 12% of mothers in the United States are not actually tested during their
Mhm.
pregnancy because we have a patchy and very basically unhelpful healthcare system, right? A lot of people simply don't get connected to primary care and get tested. And about 5% of tests show false negatives. So that means like a mother who's positive, but actually has the infection. So as a result of this, before this universal Hep B vaccine recommendation, babies in the United States were routinely getting infected with this disease, and it's largely disappeared in the United States as a result of vaccines. And there's been tremendous efforts at monitoring the safety of this. And it's basically always shown that this is a vaccine that essentially has almost no complications associated with it.
That's right. So it basically created a safety net because we acknowledge that we can't always know if the mother is infected. And because of that, why take the chance when you have a safe and effective vaccine that can be applied across the board and catch all the cases we're not going to know from testing in advance?
Yeah, absolutely. And again, we're talking about an incredibly safe vaccine that is given to everybody to prevent a disease that has devastating consequences in
Mhm.
babies as well as kids as they grow older, and has no cure available to it. So one of the kind of the most absurd things that came up during this discussion was oddly enough like a constant refrain from these ACI new ACIP members, none of whom are vaccine experts, arguing that, well, they don't do this in Denmark and other Scandinavian
Right,
countries,
right,
so
right.
why should we do it here? Well, you know what, if I was a small country that was homogeneous and that had an impeccable universal healthcare system, I also would say, hey, it's fine to wait until the third or sixth month, because you know what, everybody gets healthcare and there are no barriers to healthcare. And you've got an incredibly homogeneous population that essentially doesn't have to worry about diseases that may get imported from other countries. That is not the United States. We are a large, heterogeneous country with a terrible healthcare system that many people do not have access to.
That's right, and people will often point to other countries as an example. Like it reminds me of COVID. Like there were Scandinavian countries, I believe, like Sweden, who didn't close down and let the virus kind of run through the population, or at least that was their approach. And there were folks in the United States who pointed to that, saying, "Look how successful that was." And it doesn't factor in all the things you just mentioned. That we have a very different population, a very different size, and a different healthcare system. And so it is. These approaches don't necessarily work in every situation.
Yeah, and that is why actually you have to have a committee like ACIP, and why ACIP became basically the gold standard for how vaccines get evaluated and introduced all over the world. They use a standardized methodology that reviews the evidence carefully. They have public meetings where all of this stuff is debated wide out in the open. They're available for everybody to view. They allow public input into their recommendations, and they revise their recommendations over time. There have been times they have pulled away vaccines or reduced the number of dosages or changed the schedule. And the interesting thing here is, and I've already harped on why I say the US healthcare system is just not that great because there's so many holes in it. One of the interesting things is that because CDC was such an incredible agency and vaccines have always been such an important intervention in the US, despite our, lousy sort of general healthcare system, our vaccine program has always been admired throughout the world. The US has this incredibly evidence-based approach. It funds vaccines. It has strong recommendations. It has strong policies. And so interestingly enough, vaccine preventable diseases have always been one area that the US has outshone a lot of other countries, which have much better overall healthcare systems.
Yeah, it reminds me of, I think it was in the 50s, the US Surgeon General, William Stewart, who declared the war on infectious disease was over. We were coming to the fore with vaccines and antibiotics, and there was a lot of tools now to really combat infectious disease, and it was seen as a real triumph. And now we have the head of Health and Human Services saying, well, infectious disease isn't really as bad as the vaccines that could prevent it, that these vaccines carry a lot of risk and we really should be more considered in using them. It's like the exact opposite approach, and it's almost dismissive of the impact that infectious disease will have. And the problem is we're almost victims of our own success because a lot of the American public either hasn't seen a lot of infectious disease, so says, yeah, why is this such a big deal? Or what I heard, and I just as an aside, I listened to the panel, the CDC panel on vaccines, have their public hearing and deliberate on this Hep B vaccine. And there were a lot of callers who called in. It was a public response period. So anyone could call in and voice their opinion. And there were kind of two types of callers: people from, medical practitioners, doctors, researchers saying this is an incredibly safe vaccine. It's really reduced the incidence of hepatitis B. We need to continue with this schedule of vaccinating newborns. But then the other callers who were against it were either relaying some personal experience. Maybe they did have a tragic experience where a child got sick after receiving the vaccine, or, in one case, someone said that their child had died after receiving the vaccine. But it's tragic at an individual level, but it's never contextualized with the overall population where, we do track side effects. And even if side effects happen, they're very minimal and very, small compared to the risk of the disease itself. So you get these emotional responses where vaccines are dangerous. Look what happened to me, as opposed to, here's the evidence from large studies across populations that show how safe and effective these vaccines are. And the contrast is really palpable, but sometimes the emotional arguments are the ones that really get responded to.
You're 100% right. And this is the dilemma that we face. I mean, think about like if you monitor, so I try to explain to people when I have sort of casual complications. If you look at so many of the things that we do in everyday life, and you actually told stories about them as if they were medications or vaccines, people would not do them, right? And I'm talking about silly things like I don't know, like getting gas from eating beans or getting like food poisoning from eating chicken. Like, who would eat chicken? If somebody told the story about someone, they'd be like, why would I ever go near that? Right. Or, think about medications like Tylenol or ibuprofen or things that people take every day. If people talked about the side effects that they had about those things, and the reality is that vaccines don't get put into our vaccine schedule until they've been rigorously tested. They start with basic science experiments. They start with animal experiments done in small animals, and they move up to larger animals and primates. Then they move into safety trials on humans. Then they move into efficacy trials in humans. Then they move into real world evidence studies. And that's when they get improved and incorporated. And so I've had friends say to me, well, why are you telling me all the vaccines that I'm getting are safe? I'm like, because I'm not telling you about the hundreds of vaccines that we already studied and showed were not safe. We're not giving you those. Like, they seem to think that every time a vaccine is developed, it somehow gets put into the vaccine schedule, when in fact we have this incredibly rigorous system to basically make sure all the dangerous stuff doesn't get in. to the routine.
That's right. And a reporting system that continuously collects data on side effects. So even if a vaccine gets approved and goes into wide circulation, if there are side effects, they get reported into a database and it continues to be evaluated and analyzed.
Let's give a perfect example of that. Look at the J&J vaccine that was used for COVID, right? There was an extremely rare side effect where a very small percentage of people, particularly women of reproductive age, were at risk of getting clots from the J&J vaccine. That vaccine was simply pulled from the market. I actually think it's a very good vaccine and could be used in certain selected populations and may provide some more durable immunity than mRNA vaccines in some situations. But this was an example of where, and I wasn't opposed to it necessarily being pulled from the market, but it's an example of where the US vaccine system caught this much rarer complication, like these 1 in 50,000, 1 in 100,000 risks that you're not going to get in a clinical trial. Like you simply can't do that. It showed how our system works. And the Hep B birth dose vaccine has been given to millions and millions of kids,
Right.
not just here in the United States, but globally, without any of these effects. So we do have the safety systems in place. And I guess this is all just a way of saying that I don't know where this is going to leave us, because I only see this getting worse, unfortunately, over the next few years, unless what we're seeing is basically state coalitions. And so I think we're going to get to this point where we have a really decentralized public health system, which is good for people like you and me that live in states that are forward leaning and pro science and public health, but it's also going to leave a lot of Americans unprotected.
I know. And there's two considerations. There's the policy side, and then there's the financial side. And one of the concerns is if there isn't federal level consensus about a drug or a vaccine, that insurance companies may opt not to pay for the vaccines. Even if states mandate it or approve it, it's going to be a question as to whether insurance companies will continue to support that. And without that support, people may not be able to afford the vaccine or may opt not to take it because it's expensive. So,
Correct. Yep. And it
yeah.
includes what's called the Federal Vaccines for Children's program, which provides a huge percentage of the vaccines in the United States, which are for people who are underinsured, and their kids are underinsured or uninsured. And again, same issue. When ACIP doesn't recommend it, it gives the federal government, this federal government in particular, the opportunity to say, well, okay, well, we're just going to provide fewer of those vaccines. So unfortunately, we will have to sort of see what happens in the next year and try to keep people as aware as they can about everything, because I think increasingly people are going to have to be their own advocates, unfortunately, as some of these things sort of fall through the cracks and we don't have the same safety nets that we did before.
Yeah, and we'll continue to presumably continue to collect data on the incidence of these diseases that are impacted by vaccine decisions at the policy level. And I have an awful feeling that there's going to be a reckoning when it comes to infectious diseases, as a lower percentage of the population does childhood vaccinations like measles and mumps and rubella, this hepatitis B thing, that we'll start to see an uptick in cases, and it's so sad because they're preventable, and that's the
Okay.
bottom line.
Yes, no, absolutely. Okay, so on that positive note, I think we'll
Sorry.
be closing out our year with this, since we're going to be taking some time off over the holidays. So, Jon, it's been a great year working with you on this, and again, to everybody out there who's been listening and watching, we really appreciated your support. Please please share, please enter comments, and we hope to see you again in the future.
Yeah, Jay, I want to say thank you to this show as your brainchild. This is your real drive to engage with the public directly. And I want to thank you for setting this up and inviting me to be a part of it. I know it often sounds negative and doom and gloom. We're really trying to do our best part of the conversation is a bit of editorializing, but for the most part, we're trying to bring factual information about topical and newsworthy events. And so I hope it's been informative for you out there who are listening. We appreciate your support. And Jay, I look forward to many more of these with you.
Okay, great. Thanks a lot, Jon. All right. Have a good week, everybody. Bye-bye.
Bye-bye.